Welcome to all to Raaonline program. Today we have a fantastic topic that is regarding a thunderclap headache. Okay, specifically we are going to focus on subarachnoid hemorrhage. So the question is, why should we read about subarachnoid hemorrhage on the first place? So it is just the bleed inside the arachnoid area. So what is the emergency department going to do about it? So we are going to stabilize the airway, breathing, circulation. That's all it is. That is what we are going to do for any other patient, right? So what is specific about subarachnoid hemorrhage? Okay, so look at this image. You get a patient with a headache and you do a CT of the brain, and this is the image which is showing subarachnoid hemorrhage, which you can see as the white areas along with some clots inside the ventricles. So this is a subarachnoid hemorrhage along with intraventricular extension, right? So what we usually think is, when we stabilize the airway, breathing and circulation, eventually this patient should improve and she should go home, right? But what exactly happened to this patient is, she ended up like this. She got a huge infarct over one side of her brain and it was highly edematous. Hope you can see that the brain itself looks very tight. And because of the edema, this patient has underwent decompression craniectomy as well. So why should a subarachnoid hemorrhage produce an infarct, and why should it go to so tight brain and ending up with the decompression craniectomy as well? So we need to answer these questions. So that is the reason we need to know in depth about subarachnoid hemorrhage. So in your question proper, the examiners might ask you as, discuss about headache or how to approach a headache, or list the causes of headache. So these will be the first 2 marks for your exam. So the follow-up questions, or the question B or the question C, will be specifically about any patient telling that a 35 or some years old female has come with the worst headache of her life, or thunderclap type of headache. So what are the differential diagnosis and how are you going to approach? And they might give you a CT which you just saw here. So they are questioning you directly over subarachnoid hemorrhage. Okay, so initially you can list around 3 or 4 causes of headache, like migraine headache, intraparenchymal bleed, or even sinusitis, like whatever the headache possibilities. And then specifically you need to answer about subarachnoid hemorrhage. So let us go in depth about subarachnoid hemorrhage as far as the exam is concerned. So coming straight to the point, when you see subarachnoid hemorrhage, the bleed in the subarachnoid space can be because of aneurysm, or it can be because of a non-aneurysmal cause as well. That is like post-traumatic. Okay, so it could be aneurysmal or non-aneurysmal. That's the first thing you need to think of. So in any patient coming to your emergency department, the first step is stabilize the airway, breathing, circulation, right? So that is being done. Now coming to the exam point of view. So now you have stabilized the airway, breathing, circulation of the patient, and next you are going to take the patient for a CT imaging, right? A CT with a angiogram. Okay, in the CT with an angiogram, it comes to be an aneurysm. So now you have a patient with SAH with the aneurysm which has bled. Okay, so pre-securing us aneurysm. In that time, what will you do? The neurointerventionalist is saying that he is going to take the patient for a surgical intervention. That is the control of aneurysm. So before that, in your emergency department, what are you going to do? Okay, so your plans, your goals should be straight. That is the main goal in securing the aneurysm. Before securing the aneurysm is avoidance of rebleeding. You should do every step so that that particular patient will not rebleed. Okay, understand the risk of ultra early rebleeding, that is within 24 hours, is maybe as less as 15%. But remember, if that patient rebleeds, the chance of mortality is 70%. It's extremely high, right? So you should do everything to avoid a rebleeding.